Hello, welcome to MOT 115, Healthcare in a Transcultural Environment. Today we're going to be talking about the subcultures within healthcare itself. So we're going to start off with talking about the standard healthcare system in the United States, which is called the Western healthcare system. And this is a reliance on the biomedical belief system. This often causes ethnocentrism about the value of biomedical interventions by healthcare workers. So if you have people who come from a non-Western environment, such as Asians, for example, certain parts of Europe, Eastern Europe, and other parts of more traditional places like the Caribbean, you're going to have people who don't always trust this Western healthcare system. They are more likely to rely on traditional or folk medicines and have some level of distrust. And then, furthermore, if you are a nurse or a doctor or any other physical or any other healthcare employee, you're going to see your healthcare system as superior because that's just human nature. Then we have the hospital subculture, and this is where health is defined as the absence, minimization, or control of disease processes. The various players in a hospital all work towards this common goal. So the idea of health is that you can control everything in your life that'll keep you out of that idea of being diseased. Within that hospital subculture, you have your professional subculture, and this includes your nurses, your physicians, your therapists, your pharmacists, anybody who basically spent a significant amount of time in school to be trained to do their job. They're licensed by a legislative authority to provide health care, and again, it is in their best interests to see their culture or their subculture as being extremely important, because that's how people are going to get healthy. So when we look at these subcultures, what we're looking at is what is important to them and what is less important to them, because that will, without a doubt, give you perspective on where they're coming from, what their priorities are. Then they have been educated to put their patients first without regard to the financial costs or effective use of resources. And their oath is to do no harm. So oftentimes you'll have a doctor who orders a significant number of tests under the guise that this will help them diagnose the problem. Unfortunately, not everybody has great health care, and as a consequence, you do have that patient subculture that says, why am I getting these tests? Because I have these massive copays and I can't afford it. So again, you have to always consider both sides of the equation to better understand how the subcultures that are involved will express their experience. So then you have your commercial or business subculture, and the support system includes maintenance and supplies, financial responsibilities, and marketing. So in this context, what you have to think about is the people who are running the hospitals, the clinics, the long-term care facilities. These places have their own issues, specifically relying on the financial responsibilities that they have to pursue. So when we keep getting hounded by bill collectors for a hospital visit, we're irritated and we feel oftentimes that we're owed health care, but in the United States, that's considered a privilege and not a right necessarily. And I'm not going to argue whether that's right or wrong, but the reality is that these subcultures are based on the idea that they have to sustain themselves. They're not getting a lot of help from the government. Consequently, there is often a clash between the professional subculture and the business subculture, especially in terms of cost-effective care. Monetary managers look at the cost-benefit analysis of a test or a procedure. And as a consequence, healthcare often becomes a compromise as a result. So if the doctor wants to send your child for genetic testing to determine if their autism has something to do with their chromosomes, a lot of hospital administrators and doctors will have to compromise and say no because it's just too expensive, and what they're going to learn is not going to help them as much as perhaps just sending the child for remediation and therapy. So as a nurse, as a doctor, as a physical therapist assistant, any of those jobs, you're always looking at these compromises that make people uncomfortable because the cost and the benefits play into every decision that's made at that marketing and financial responsibility level that institutions have to manage to stay in business. Then we have technology-based healthcare. The more high-tech the specialty is, the more status it is given by society. For example, people who work in cardiac surgery have a higher status than someone who works in a rural care facility. Rural care facility would be like a clinic out in the middle of Wyoming, which is one of the sparsely populated states in the United States. Whereas somebody who works at, for example, University of Pennsylvania in their cardiac department is going to have a much higher sense of importance. And again, these are all folks who are doing the same job. It's just slightly different based on what their focus is. Long-term care facilities, whereas a hospital wants to cure and release a patient, the long-term care facility expects progressive decline and death. In a hospital, a sick person is called a patient, but in a long-term care facility, they are called a resident. And this dynamic is very important because what you see in a hospital is they want to get you out as soon as possible so that there's a very unlikely chance that you will deal with any of the germs and issues that come with being in the hospital, whereas in a long-term care facility, you're going to be living there till you are ready to go. And that's why in a lot of these long-term care facilities, the way that the nurses and the doctors interact with the patients is much more friendly, it's much more collaborative, because this person's there every day and they see them every day. So a major issue in working with healthcare is the dichotomy between the ideals learned in school and the practical realities of the daily work. And this leads to what we call culture shock, because we have this idea when we start nursing school or any other healthcare program of helping sick people and working with them and all of those generous feelings we have inside. But the reality is that it's a business, especially in the United States, and as such, there's going to be restraints and constraints that limit how much we can do or not do. And then finally, we have our patient subculture. People who come to healthcare facilities are essentially what we call vulnerable strangers, meaning they are isolated from their normal daily activities. Patients who go into long-term care have to deal with losing their privacy. Western values prize individual space, yet in a residential environment, the patient has to adapt to a shared living space and being dependent upon caregivers for daily needs. So, first of all, when we're looking at any kind of healthcare facility, this person who's there is at their most vulnerable. They're sick, they're injured, they're weak, They don't have their normal sense of identity. So that patient subculture fills that void of what it is to be an independent person and to become very, very dependent on others. And, the other issue with long-term care is that, we as people of the United States or any country really, we have been used to doing things ourselves. We're independent. We take care of things. And when it's time to go into a long-term care facility, you've really come to a point in your life where you don't have as much opportunity to be able to improve so that you can go back to taking care of yourself. You're also dealing with that identity issue of what this person is dealing with, in the sense that they're not necessarily going to get better. They may improve slightly, but they'll never be the person they were 10 years prior. And that is very difficult for a lot of people to deal with, which is why you oftentimes people who are very cranky or very upset about life, because it's just not what they envisioned for themselves when they were 30 years old. So that's it for today. It's a short one. If you have any questions, please email or text message your instructor. If you are not a student at our college, please leave a comment and we will respond as quickly as we can. Thank you and have a great day.